Konstanze is a visiting researcher from University of Valencia. She's going to speak a little bit about her work today. Very excited to hear.
The door and enter again. All right, so this was very emotional. I wasn't prepared for that, but I definitely feel like this is a very different lab, and I think one of the most important things that I've been also learning through the last month is the quality of people that work in this lab, how welcoming they all have been. Also for me as a visiting researcher, as a visiting scholar, and yeah, I really hope that all of you keep connected and keep doing that hard work that you're doing. And for my side, I'm going to introduce some of the insights from the work that I've been doing back in Spain at the University of Valencia. And yeah, just some insights from a project that is called SEL4, and links social emotional learning with mental health, with well-being, and with inclusion. And I will be happy to share this work with you today. And also for those who might not know me, I'm this is just switching around, sorry for that. I'm an associate professor at the University of Valencia. I'm a member of the so-called MENA research group you see there in the picture. MENA stands for Education, Emotional Education, Childhood and Adolescence. And my academic background is more in clinical psychology, specifically in mental health in children and adolescents. And this year I have the privilege to being a visiting scholar here at the lab at Harvard Medical School with the RCC fellowship. And yeah, it's has been a pleasure this last month working together with all of you. And I really hope this will be also an opportunity today to get further into discussion and share some of my research, but also your eyes on it. And really like being in this lab has opened a little bit my eyes and gives me like a broader global mental health perspective, right? So yeah, what might this talk be interesting for you? Let me begin with this question, and looking at this word cloud, you can probably already identify some of the themes that connect maybe also to your research interests. So the project SEL4 sits at the intersection of mental health, prevention, social emotional learning, well-being, inclusion, education, and also technology. So although we may approach these topics from a very different perspective, maybe you more from the global health perspective, or even implementation science, digital health, education, prevention, we all share a common goal, which is helping young people, children, and adolescents to develop skills and resources that they need in order to thrive. And this brings me also to the question that will guide me through my presentation today. How can we reach all young people before mental health difficulties even emerge? Or more importantly, even how can we do so at scale in ways that are accessible to everybody and engaging and sustainable? So let's start. And like being here in Boston also brings me to this fascinating facet of Boston, Freedom Trail. This journey through different landmarks that maybe you have been discovering also that tells the story of American independence. So this is something you can look forward to. And in this presentation, sorry, let's go back. In this presentation, we will follow a different trail, the SEL4 trail, which was also quite a journey. And I will share with you our project stories through those 7 different stops. First of all, introduce or discuss some challenges that young people are facing today. On the second step, we will look at some evidence about social emotional learning related to mental health. Then I will introduce the project, how we designed this project, also how we tested it. So I will show you the method, some results, and furthermore also what have we learned from our project, what are our future steps, and the last will be the Q&A. So let's start at step 1 of our trail and talk about these challenges. I feel very passionately about children and adolescents development. I feel it's a very important period of time where young people develop not only their identities, but also learn how to regulate their emotion, build relationships, and imagine the future. But they're doing so under conditions that are becoming increasingly more complex in this world. So, for example, digital life has transformed how young people communicate, how they learn, how they also compare themselves to others. Also, academic pressures continue to increase in many educational settings. Many young people report also their own loneliness despite being constantly connected over their phones. And others also experience violence, neglect, discrimination, displacement, or social inclusion. And globally, many of them are growing up with also climate anxiety, uncertainty about the future. So these challenges do not occur in isolation. They interact, they accumulate, and they influence how these young people perceive themselves, how they relate to each other, and navigate life. And as a researcher, also as a mental health professional, we must ask ourselves, how can we support young people in developing those skills and resources that they need in order to thrive under these difficult conditions. And also, this becomes even more urgent when we look at the data. So according to the World Health Organization, approximately 1 in 7 adolescents experience a mental health disorder. That accounts for 50% of the global burden of diseases among young people. Symptoms like depression, anxiety, behavioral disorders are among the leading causes for illnesses, and also suicide remains one of the leading causes of death among young adults. So within Europe, the context where I work, UNICEF estimates that more than 11 million children and adolescents, which is a huge number, experience mental health difficulties. And these statistics just remind us that mental health is a fundamental public health challenge. And that means that prevention and early intervention is not only optional, but really essential. And these concerns are also reflected in current European policy priorities. So new World Health Organization and UNICEF unified strategies for children and adolescents identify mental health as one of the major priorities for the oncoming years from 2026 to 2030. And alongside mental health, there are also key issues of concern that include excessive screen use, social media exposure, substance abuse, unhealthy lifestyles, and social inequalities. So what is striking is that many of these issues have been a strong social emotional dimension. They involve self-regulation, social relationships, belonging, and resilience. So this brings me to to the main challenge, the central challenge, and also our research question. So how can we, with the help of public institutions like schools, help students to build the skills and the resources they need to thrive? So we know that social emotional skills, for example, are strongly associated with mental health, with well-being, academic engagement, and social inclusion. And we also know that schools have this universal reach because most of children and adolescents, they spend a lot of time at schools, most of their day, actually. And this gives schools this unique opportunity not to simply teach academic content, but also support the development of those social emotional competencies that help young people to navigate their life more easily. And from a global mental health perspective, schools may represent one of the most promising prevention settings. So this brings me to our research question, which is how can we strengthen social emotional skills in ways that promote mental health, well-being, social inclusion among European students? And our answer was to develop and evaluate a digital intervention, specifically a serious game that is combined with classroom-based learning activities. And rather than delivering SEL only through traditional lessons, we wanted to explore whether game-based learning could increase engagement while maintaining educational value. So I just want to pause you for a moment and give you the opportunity to think about these questions and how they might relate to your own research questions. You don't have to answer, just think about it. And let's move on to our next step, which is what does science tell us about the link between social emotional learning and mental health? So our project is grounded in the CASEL framework, which is well, you may know it or not. It's a framework that identifies 5 key competencies. So social awareness, social management, social awareness, relationship skills, and responsible decision making. And what is particularly interesting from a mental health perspective is that these competencies not only predict positive youth development and positive health outcome, they're also linked to psychological well-being, to resilience, social inclusion, and mental health. So research over the last 2 decades has consistently shown that social emotional competency matter, that students who possess stronger emotional skills tend to report greater well-being, better mental health, and more positive school experiences, and also more resilience facing adversities in their lives. And at the same time, social emotional learning also contributes to inclusion, because students with stronger social emotional competence tend to show greater empathy, better peer relationships, and lower involvement in bullying. So taking all this together, the evidence suggests that social learning helps young people to flourish, not only academically, but overall socially, emotionally, and also create school communities where students feel that they belong. So this is what we know. We know that mental health starts early. Almost half of mental health difficulties emerge before the age of 15. And schools are the ideal setting because they reach almost all children and adolescents. And we also know that prevention is key, right? Supporting young people before difficulties then emerge is even more effective and more sustainable than responding only when problems already have developed. So, but having the right setting is not enough. We also need approaches that actually work. But we know that social emotional learning programs work. From recent studies. There has been a meta-analysis that shows that these programs actually enhance with a medium effect size social emotional skills, school belonging, for social behavior, academic engagement, and emotional well-being. So if SEL works and school reach nearly everyone, how can we make social emotional learning engaging and meaningful for today's adolescents? So our response was combining social emotional learning with gamification, developing this education video game, a serious game. And this brings us to our next step, how we were designing this program. And here. And SEL4All, the name stands for social emotional learning for all. And it was designed in order to promote not only social emotional competencies, but also to promote mental health and well-being and social inclusion. And importantly, it wasn't designed as a clinical intervention. We were not attempting to treat mental illnesses, but attempting to strengthen those protective factors before difficulties emerge, and as a prevention, as a mental health promotion strategy. And this is our team. So SEL4All was funded through an Erasmus Plus project and brought together an interdisciplinary consortium across Europe involving 6 European universities from Finland, Germany, Italy, and Spain. And here you can see the core team of the SEL4All sitting together having breakfast. And our primary target group is students transitioning from primary to secondary education, because we know that this transition is particularly important because it marks a major developmental changes where students have to navigate new environments, new academic demands, changing peer relationships, identity development, and also increasing independence. And this is when emotional difficulties start to emerge. So the project had 3 main objectives. First, to promote social emotional competencies, well-being, and inclusion through a serious game. Second, to ensure accessibility and equal opportunities by providing the intervention in multiple languages and making it available to diverse student population. And third, to develop supporting educational materials that teachers could easily integrate into their classroom practice. And also one of the key features was the co-creation approach. So rather than designing the intervention for young people, we designed it with the students and the teachers. So they participated in focus groups, in interviews, in testing sessions throughout the development, and that helped a lot in order to shape not only the content, but also the design of the game. And the content of the game was informed by several complementary theoretical factors, some of those that I have presented before, the Castle model, but also other social emotional education frameworks, positive youth development and character development models, and the European LifeCom framework. And these models helped us to identify the teachable competencies that then could be translated into active experiences and different challenges and missions throughout the game. And developing SEL4 was a 3-year process, and we began with focus groups and need analysis, and then designed the educational content.
I think your animation is set on automatic.
Yeah,
it's a setting.
Automated. I'm
Unfortunately,
so sorry.
Your deck is. Yeah, you're gonna have to do this for every slide.
Yeah, I'm sorry. So we designed the educational content, developed the prototypes, collected also feedback after playing and refining the game, conducted pilot testing, and then finally the intervention study. And throughout this process, students repeatedly informed us about improvements, how they would like to have the intervention changed, because when they are bored or confused, they let you know. So their feedback was really valuable throughout the whole process. And what I wanted you to ask you before I present our serious game or the video game is, what kinds of video games do you play? And when you play games, how do they usually make you feel? And it should be a code there for the Mentimeter, but maybe you can just think about it and then we can discuss it later. So think about video games that you enjoy, that you play. I know maybe most of you are not in the generations that are still playing video games, but definitely you have been playing some of the video games. And think about, how do you feel like when you're playing those video games? Why do you play those video games? Is it something that makes you feel excited? It's something that makes you feel maybe forgetting problems of everyday life? Are you very competitive on playing games, or are you maybe more into the mission, exploring everything? So take a moment to think about your favorite video games and how they make you feel when you play them. And you can share, if you like, some of those experiences later. All right, so this is something that we ask, of course, our students to get some ideas how we should design our serious game, our video game. And also it was exciting to learn what were actually the reasons for students to play video games, how it made them feel. And then we compared that, of course, to what we have learned from our implementation. So the serious game, our serious game that we developed, it's called Portals of Growth, Your Self-Adventure. And students explore in a virtual world and progress through different gates or portals. And each gate or portal represents a different domain of social emotional development. So there are 5 gates. The gate of self, the first one that focuses on personal development and identity. The second, the gate of people, that focuses on social development and also peer relationships. The gate of knowledge, that focuses on cognitive skills and growth mindsets. The gate of emotions, that focuses, of course, on emotional development, empathy, and compassion. And the final gate that focuses on moral development. And students move through those gates. They complete missions, they solve challenges and make decisions and engage with non-playing characters and NPCs. And importantly, every game mechanism was linked to a specific learning objective. So the purpose wasn't simply to entertain the students, but of course to create meaningful experiences that encourage reflection and skill development. And the intervention actually consisted of two interconnected components, as I said before. So the first was the serious game itself, and the second component consisted of the classroom-based materials for teachers. So teachers used worksheets, discussions, role-playing exercises, reflection activities, etc., that students experience in the game. And so the serious game was more a way of getting students' attention and interest, and the classroom activities help them to consolidate those learnings. And together they create the intervention that is both engaging and educational. And let's see if we can see maybe the trailer from our game. Let me try. Are you confused? To give you an idea of how the game looks like. Also, just giving you an idea of the visuals, the aesthetics of the video game. And now let's come to the next step, to testing this solution, to know actually, did it work? How did it work? Because it's important, right, to also get some data on that. So to answer the question, we designed a protocol for multi-country evaluation of the SEL4 program, and our evaluation followed a quasi-experimental longitudinal design. We collected data at 3 time points: before the intervention, after the intervention, and a 2 months follow-up. And we also adopted a mixed method approach. So we not only used quantitative self-reports, but we also conducted qualitative interviews and focus groups with students and teachers. And the intervention was implemented in Germany, Spain, and Italy, and Finland. It was also implemented, but they didn't take part in the implementation study itself. They didn't use the same equipment. But yeah, so 4 students here in the intervention group participated. The students that participated in the intervention group, they were doing the SEL4 program for 6 weeks, and the students from the control group, they just continued their normal regular school curriculum. And overall, more than 1,500 students participated across these 3 countries. But there was some variation in the implementation across contexts. So as you can see, maybe in the slides, sample sizes varied a lot. Also, gender age distribution, dropout rates were different between countries, and these differences are important when we then interpret the results. We assessed a broad range of outcomes related to well-being and mental health, so including school well-being, student well-being, burnout, and also symptoms of depression, anxiety, and stress, which we only collected data on in the Spanish sample. Of course, we also assess social emotional competencies. That was what SEL4 was designed to strengthen, right? But also other skills like open-mindedness, emotional regulation, and perception of inclusion. And since SEL4 is a digital intervention, of course, we also were interested in understanding how students actually evaluated the game itself. So we also assessed user satisfaction, the game experience, the learning experience, and also the completion rates. So to evaluate the intervention, we conducted 4 complementary analyses. First, we examined students' perception of the game. We explored then within group changes over time. Third, we used mixed effect models controlling for factors such as age, gender, and country. And finally, the most importantly, we conducted time by treatment interaction analysis. And for the sake of clarity, I will focus primarily on the game perception and the last interaction model. So let's begin with game experience or engagement. So overall, students evaluated the intervention, sorry for that, as quite positively. So it's interesting how different patterns emerge in different countries. So students in Spain, for example, reported higher completion rate, spent more time playing with the game, and reported higher levels of satisfaction. Italian students also evaluated very positively the learning and the game experience itself. And German students were the one that reported lower completion rates and lower overall engagement. And these findings become important again because the strongest outcomes effects were generally observed in contexts where engagement was high. So let's see now the general interaction models, right? So looking at these data, especially at the interaction in the last column, students in the intervention group overall, in comparison to the control group over time, showed improvements in different indicators of school and student well-being. So, for example, in positive attitudes towards school, positive academic self-concept, and doing, which is a behavioral indicator of student well-being. And we also observed a reduction in some indicators of school burnout, such as feelings of inadequacy and cynicism. And the strongest effect were observed in Spain, where we also found a decrease in depression and anxiety symptoms. And Germany and Italy showed more modest changes. And in the follow-up findings, they are particularly interesting because they tell us whether those changes actually persisted over time. And in the 2 months after the intervention, we continue to observe those improvements in several dimensions of school and student well-being. Also, the decrease in burnout symptoms were maintained in the follow-up, and some of the outcomes even appeared stronger at the follow-up than immediately after the intervention, especially in the Spanish sample, as I said before. And when it comes to social emotional competence and inclusion, immediately after the intervention, the results were more modest in the post-test intervention comparison, So the most promising finding here were an increase in emotional inclusion. And students appear to feel more accepted, more connected with their school environments. And we also observed some promising country-specific findings. So in Germany, for example, there was an increase in self-awareness. In Italy, for example, there was an increase in cognitive reappraisal as an emotional regulation strategy. And in Spain, we observed an increase in curiosity. The follow-up analysis painted a more optimistic picture because level competence showed improvement over time, including relationship skills, responsible decision-making, cognitive reappraisal, academic self-concept, and also some of the indicators of inclusion. So it seems that some of these effects become more visible at the 2 months follow-up than immediately after the intervention. And this pattern may indicate that students need time to apply, to integrate what they have learned into their daily lives and report it in those self-assessment tools. And as I said, we also conducted qualitative interviews and feedback analysis because numbers tell us a story, but then students themselves have another perspective. And it's important to also capture that with qualitative research. So in the focus group that we did, Students highlighted several aspects of the game, about the game that they enjoyed. They appreciated a lot, like the exploration, the puzzles, the interaction with the NPCs, and the opportunity that they have to make their own decisions. And they reported that the game encouraged reflection about themselves, about their emotions, but at the same time, they also gave us some constructive criticism about that. For example, the navigation that was not so clear, or too much text sometimes, or they needed more support features. So we actually use those comments that are incredibly valuable in order to consider them for the final rework of the series game. And also during the individual interviews that we conducted with students, they described, for example, positive mood changes while playing. Others reported becoming more aware of their own emotions. Many spoke about improved communication with classmates, that they had a greater willingness to help each other, and they noticed a stronger class cohesion and greater mutual support. And what was most surprising about those interviews, that students really actually talked about social emotional learning itself, but instead they talked about friendships, about helping each other, about feeling understood and connected. So from all these quantitative and qualitative analysis, what did we learn? So I would say that the first lesson, and this is probably one of the most important ones, is that schools are a powerful platform for mental health promotion, strengthening students' well-being and inclusion. So across our findings, we observed improvements in positive attitudes towards school, academic self-concept, but also emotional inclusion and social emotional skills as relationship skills, responsible decision-making, and also cognitive reappraisal. So students described also greater self-reflection, improvement in communication, stronger class cohesion, and positive changes in their own mood. So that means that mental health promotion may begin long before anyone enters a clinic, and may inform about symptoms, even before those symptoms appear, and may begin even in those educational settings. So school can be those few places where we actually reach nearly every young people in order to prevent mental health symptoms to emerge. And the second lesson, I would say, was that engagement matters as much as effectiveness. So as researchers, we often focus on effectiveness, like did the intervention work? What was the effect size? What was the p-value? And this is an important question, but also students actually, how students actually engage in the intervention is also quite important. So our results had different results here, and they were quite different across countries. So for example, in Spain, we saw that they completed more of the game, spent more time playing, and this actually generally showed stronger outcomes for those students. While in the students in Germany, for example, they showed lower completion rates and more modest effects. And in Italy, they reported high satisfaction, but then we didn't obtain follow-up data, so we're not sure how the impact was here. So rather than only focus on what works, we also should focus on how does our intervention works, like in which context, which conditions, and perhaps most importantly, how do we create interventions that young people generally want to use and engage fully. And the third lesson, the last one, is that digital social emotional learning programs may help you scale mental health prevention. So we know if we rely only on mental health professionals, we will never be able to reach every young person who could benefit from prevention. School, however, provide this existing infrastructure with universal reach. So our program suggests that when we combine schools, teachers, and engaging digital tools, we can actually create scalable opportunities to strengthen protective factors and promote well-being among large numbers of young people. And the key message here is not technology will replace teachers or teaching or mental health professionals, but rather technology can support teachers, increase engagement, and help deliver those prevention programs. And yeah, from there, what are our next steps, what we want to do next. We think that social emotional learning, especially the SEL4 program, had answered some of those questions that we opened at the beginning, how schools can help, right, to teach, to develop those skills that help mental health prevention, but how can we better support all children developing those skills that they need in order to thrive, and therefore, definitely to answer those questions, we need more research. We need more research that should explore all larger international studies, longer follow-ups, better understanding of what drive those changes. Is this the game? Is it the teacher? Is it the classroom activities? Like, what are the conditions? And at the same time, new technologies offer those excellent opportunities from adapting learning, AI-supported tools, but also like more personalized learning experiences. So that could be also an important next step. And also from a global mental health perspective, I'm particularly interested in prevention at scale, right? Like how we could maybe reform school mental health systems to include social emotional learning in the school context. How can we also support and promote not only student well-being, but also teacher well-being, and especially those from more vulnerable populations. And last but not least, this project, I think, also opened new opportunities for more research, for more collaboration. So these are like 5 pathways that I'm specifically interested in when it comes to like our future research in terms of, how can we understand, how can we understand schools as a scalable ecosystem for mental health promotion, but also when it comes to teachers as a very valuable resource in mental health promotion. How could we include them in our future work? How can we support them? And also when it comes to supported digital interventions, how can we use them as an opportunity to personalize our interventions? And also, I'm critically interested in understanding those pathways to well-being in a digital area, how the use of social media, digital relationships, online gaming actually affects the young people's development and mental health. And finally, also, of course, I would like to continue exploring the social emotional skills as a protective factor that helps to promote mental health and well-being. So I'm excited to keep investigating in those areas, and I think it's an exciting opportunity to collaborate also with you, to also do joint publications, cross-cultural studies, future grant proposals. So if any of these topics resonate with your work, would be delighted to continue the conversation after the presentation. And last but not least, there's always more material and no time to present it all. So maybe during the QA, we could discuss some of these topics that I didn't have time to actually go more into depth today. The co-creative approach, the cross-cultural differences in the implementation, the own lessons that we learned from implementing the program in schools, and also the effect of digital tools. So there's a lot more to talk about, but not time. So this is actually for the QA. If you, I would like to introduce this final question and also to finish with this final questions. Can we use social emotional learning to become a strategy for global mental health promotion? I don't know the answer, the definite answer, but I'm really interested in hear your thoughts. And maybe my final thoughts for today are the following. If we want mental health for all, we need pathways that reach all young people early on, and schools may be one of our most promising starting points. So social emotional learning may be one of the tools that helps us get there. And maybe just some acknowledgements. This work couldn't have been possible without, of course, all the students, teachers, and schools and education communities that have been participating in our project. Of course, the colleagues from the MENA research group and the members of the SEL4 consortium, the funding institution, the European Union. But also, I would like to thank you all for being able to share my research with you, especially Vikram for inviting me, Laura, who is also there. I hope you have a good recovery. And yeah, also Katie for helping me setting up. And yeah, I'm really appreciate being able to share my work with you today. And thank you for your attention. And I look forward to a conversation, your thoughts about all this. And if you want to get more information about the project, here is our website and podcast that we created, and also our social media. Yeah, so thank you.
Very much, Konstanze. So I know we're a little tight on time. Maybe we'll see if there's any questions.
Yeah, we can go on to about 10 minutes.
Yeah, we have it. Yeah. Oh, yes, please.
So this is a fantastic presentation. Thank you, and I can see that lots of work ahead. So I'm curious to know, so with social emotional learning in the US, there is some resistance by some communities against schools that introduce social emotional learning in their curriculum. Whether that's or oftentimes it's from more conservative communities. And I know there's some people at the Ed School doing some research around that, but I wonder if there's any thoughts about that, even though I know the political climate, the environment is very different in Europe, but whether some of the kind of learning that you do going forward with qualitative research tries to capture some of that variation across ethnicity, across age, gender, that might form some of the variation you're even seeing in those three countries with engagement.
So I'm not sure if I understood your question. It's about qualitative data in order to see how there are variations also in Europe in terms of gender, age, race. Oh, okay. And the resistance maybe in about social emotional learning. So this is kind of interesting. I have seen also some in other contexts and in Asian contexts actually this resistance of social emotional learning that still exists because depending on the school system and this priorities maybe also in the school system, social emotional learning or social emotional competencies might not be perceived as so important. But I think, as I stated at the beginning, if we think about how the world is changing, how AI also is changing, how we learn, and maybe what competences we need in order to thrive in this world, I think more and more we should actually go from more traditional academic content, right? Which is also important. And I think it's important to have those foundations, but I think it's more important to actually develop those competencies that help young people from an early age in order to be responsible citizens, in order to have critical thinking, to have a growth mindset and be able to cope with all those challenges that lie ahead of us. And when it comes to qualitative data on differences, maybe those cultural differences that we saw in at least the 3 different European countries, I would say that for this intervention in general, all students have been different to gender, to age, enjoyed the opportunity to actually do sessions about social emotional learning, video gaming, than other than just the normal academic context. But it's true that especially younger children were more engaged than older students. And also, but this is independent maybe for gender, but specifically the younger students. So at the end of primary school and the beginning of secondary school, they were more engaged than maybe later secondary school. And this might also be because when it comes to serious games and video games, they have much more experience with that. But also because maybe they yet really are interested in learning new competencies, and they feel that they still have a lot to learn. The older the adolescents, the older the students, we have the feeling that it's harder to engage them in something that is not of their own interest. So this is some of the data I would share on that account. Thank you for the question. Yeah. Hi.
Thank you very much. It was probably wonderful work, and I love the fact that you're looking at use of video games to like really engage the young people, because I think most of them are very interested in video games. But
Yeah,
when you are presenting, most of the questions that were coming to my mind were from the implementation side and scalability, because the results from the clinical trial are fantastic, but clinical trials tend to be very controlled.
Yeah.
I don't know if I missed how you talked about engagement, community entry, like engaging the community or the people you are looking at. But just to point out, and it asked whether your game was engaging teachers, because if you're looking at scaling this on a global level, if you're engaging teachers, then most of the times they're going to look at increasing their work. And are you paying for that increasing the work? And if at all you are engaging teachers to facilitate your game, that could be like probably something that could prevent your game from going on. So that could affect adoption. And then also you talked about the adolescent, the older students.
Mhm.
I think most of them, because like you say, technology is moving very fast, and people care about graphics, people
Yes.
care about how the game looks like, the aesthetics. And I think that in itself could have affected that. Then I was wondering if you actually went into probe why there was more acceptance in Spain and less acceptance in Germany, because I think there could be very many answers that could probably inform why there is more acceptance in a party, because you're from Spain.
Yeah.
You are
Well.
perhaps more. And those are things that I was thinking about, because you have to question why the German students were not really engaged and things that broke up. But looking at it from like then it's a scalability issue, I think very many times we find solutions in research, in innovation, global mental health, and whatsoever. But why these solutions don't tend to go into the real world and make an impact, because we have to really, and I do love that you used human-centered design, you engaged different stakeholders to think about how the solution would look like. But then probably you should also think about how do we push it from the research phase to be adopted. And there are quite very many hurdles there that you could think about. Thank you.
Thank you so much for your questions. So insightful, and it actually gives me the opportunity to talk a little bit more about scalability, which is something that I'm really interested in and also worried about. And let me maybe start talking about the role of teachers. Because exactly in order to scale, to get to a greater scale, we have to involve more teachers, which are who are actually the ones delivering, right, this intervention. And a lot of those teachers, exactly, they already have a huge workload. They already have a lot on their plate, right? So it's hard to convince them that our program will be only a slight more work that they have to face. And our goal actually was to make it as automatic as possible. So one of the things that we thought about using the video game is that students can play it on their own. They don't need the teachers for that. But then teachers, they usually have at least 1 hour a week session where they do talk about different things, like tutoring sessions where they include, for example, social emotional learning, or maybe other topics in terms of discrimination or prevention science, right? So it's a good opportunity to have some material that we can give them. And this material was delivered in a way that they had those video tutorials that they can watch very quickly to get a quick overview. What is the game about? What is the material about? And then implement it more easily into their classrooms. But still, there's always a little bit of resistance when it comes to teachers. And our approach, and I'm convinced that one of the ways to engage teachers more is do something more for the teachers. So what we do is engage teachers in a teacher training where we not only focus on students' well-being and how we can implement social emotional education for students, but how can we actually promote teachers' well-being. So the teachers are actually the main purpose of those trainings, and we help them to identify with their social emotional competency how important it is not only for their students but for them. And if they see how important it is to be more in contact with their emotions and to actually engage with, connect with other people to train their own skills, then they become convinced that this is also important for their students. So I'm really convinced that the way of engaging teacher more is actually doing this kind of work for the teachers so that they see how important and impactful social emotional learning is, and then actually use those kinds of programs in their classrooms. So this is one of the strategy, but I think at the end, it's very important to not only include teachers and count on their time and their generosity, but actually to include schools and, as I said, reform school systems where social emotional learning becomes like a mandatory thing, where everybody has to include it in their classrooms. And then this would actually help in order to maybe not force, but give teachers the opportunity to bring that into the classroom as something that is already mandatory. And yeah, so I think that would help. And when it comes to differences in Spain and Germany, I think, of course, we have to look more on what are the conditions that actually helped in order to the program to be successful, to be more effective. So is it actually because in Spain, maybe the teachers were more engaged and helped the students more with the video game? Or was it because in Germany, maybe they had less time to play because they didn't complete the game as much as the Spanish students? So what we have to control more actually the implementation itself and find out which are the moderators, right? That helps us to get more effectiveness in our research. And yeah, thank you so much for insights. If there are some questions I left open, maybe we can just talk more about it later.
We only have time for a couple more questions. I just have one really, I'll try to keep the question very quick. I think
Since Cindy's got a question.
Oh,
So
Cindy's got a
I'll tell you what, why don't we bunch them together? Maybe we can make them as comments, because I think
Yeah.
we need
Yeah.
to split.
Mhm.
And
Makes
so
sense.
maybe if you could just record the comments, I suggest Konstanze,
Sure.
and then you can also connect with
That's-
people. That might be a
That
more
makes
effective
sense.
use of the
Yeah,
time
in
we
order
have.
to-
So
I don't, mine's more, yeah, the comments actually really good. What do you think will happen with the class? So it's a classroom-based intervention, but as classrooms now increasingly go anti-digital, with no phones, no computers, nothing, how do you think this could translate to a non-digital format? I'm just curious, because I actually think that's the future of education, is non-digital.
My kids about that right now.
I was just gonna advance
Yeah.
possibilities, because you're talking a lot about buy-in from all these different stakeholders, whether they're the Asian cultures or teachers or older kids, which is that when I think about social emotional learning, I understand how so important for mental health and education, but for the regular person to say it connotes vulnerability, which is hard to connect to those outcomes, and especially for say Asian cultures, that's sort of taboo. For adolescents, like they don't want to be, that's the opposite of what they want to be. And so I wonder about just that buy-in, how to actually cut through this connotation of you have to be vulnerable, and that somehow a video game is going to do that. And I know I have a 13-year-old, and I was thinking about who's always skeptical of everything from adults. And so we might be so enthusiastic about it. But in this like very short period of time, adolescence, it's that skepticism that's really sort of hard to think. Just curious how you address that going forward.
Yeah.
This is such a huge undertaking. Really appreciate the presentation.
Caitlin, and okay, we'll have two more, and then I'll just make a comment, and then you can reply to whatever you want.
I do.
In terms of perceived risks of digital tools, I thought of Michael Sandel's work on meritocracy and how you like just the process of gamifying something, making it like a kind of like a response, a winning response. And I wondered if that was something that you considered in the development of this, like gamifying socio-emotional skills is a good idea,
Yeah, thank you so much for your presentation. I think it's quite timely given the rise of user-generated games worldwide, whether it's because of like vibe coding or platforms like Roblox that host 40 million youth creating their own games every day. So I'm curious if you were to give advice to someone creating their own game, trying to replicate your study? Like, what are some of the key takeaway ingredients for creating engaging, successful social emotional learning platform?
And I think the final comment I want to make, Konstanze, is just as this is the more broader question. It's about suggesting you situate your program within the broader literature on universal school, whole school interventions. There's a very large literature on this, and it'd be good for you to look at that literature and how interventions have been, as it were, the categorization of interventions. Those that target individual children and those that target the school environment tend to be the two broad ones. And you will find that the evidence is quite mixed in both these categories, but it's worthwhile looking at that literature. It looks very much like yours is an individual. Most of the individual focused interventions have been teaching kids basically social and emotional skills, but in classroom format, much like what John is describing, either with textbooks or guided exercises and so on. And there's a pretty large literature on that. So you may want to look at how your intervention differs from the others, both in terms of content and in terms of delivery. The second thing is, this I think is important for all trials, and this is a general lesson I've taken away from my own work, is what works or does not work in the aggregate may not actually be what happens in subgroups. Mm-hmm. Now, you're never powered for subgroups, but I think there are certain subgroups with children which are very important. Gender is the most important one, and that I think Aisha might have mentioned. But the other one is also social class, and to the extent that actually mental health issues are not equitably distributed in a class, you may want to ask questions. It could very well be, for example, your program was only a little bit more effective on the aggregate, or not at all effective on the aggregate, but for a certain pre-specified subgroup, actually it was very effective. But obviously you have to think of this right at the outset, rather than afterwards. So, and that's a kind of equity-focused analysis. Mm-hmm. Unfortunately, most trials are not powered for that because we always look at the aggregate. But even at an exploratory level, simply having a subgroup analysis can be very helpful. So we have a few minutes. If you want to reply to anything, to give you the last word, but keep it brief so that we can move on to Janita's talk.
Yeah, let me. I really don't want to steal more of your time.
No.
But I think all the comments have been very useful, and they're actually also drawing from some of those concerns that we have been listening to. For example, what you said about I'm not sure who it was it John? Probably about the classroom and the digital classrooms that we're going to. We have been facing also those challenges that some of those schools that we have been collaborating with then prohibited the use of tablets and mobile phones, so we can actually do the intervention in the school. We decided to do outside of school. So this is actually in development that we see also in Europe. So although students and adolescents still like to be online, still like to use technology, maybe school is not the place to do that. So maybe we have to adapt to that movement, which makes a lot of sense because maybe we want to separate, right, education and technology to the point that, it's not interfering with those competencies and contents that we want to deliver. And I also like to comment about vulnerability of students. And this is actually something that we thought about and that's why we wanted to have this individual gameplay where students can play the video game by themselves. And then in the classroom setting, maybe talk about some of their experience, but therefore it is actually important that they feel in a safe environment where they can be vulnerable and actually share some of those emotions or difficulties that they have experienced, and actually share some of maybe the social motor learnings with their peers. So that's why what we in the end saw is the social motor learning wasn't like a big actually thing that students talked about. They talked more about how it brought students together, how they were maybe developing new friendships, how they were feeling more connected and understood, just having the opportunity to share some of their experience with others. And yeah, and also maybe I'm talking about this aspect of universal school, social emotional school interventions and more individual focused, and what was effective, what was not effective, and thinking about those different subgroups. This is actually one of the analyses we have done that I haven't presented, which actually was one of our most interesting results, because we were really interested in to see how in different subgroups, when it comes to students from a more vulnerable background, from maybe minority groups, with also maybe special education needs, had different experiences and different outcomes with the intervention than maybe the overall group. So this is definitely something that we want also to inform one of the papers that we're working on right now about the results, to look actually at specific subgroups and how they can benefit from these kinds of interventions. I think it's very valuable, as you said, in terms of liquidity and how we can support those populations. So yeah, thank you all for listening.
I can share conversations going if anyone is interested.